What up, Facebook? This brother Tezwan, and I wanted to take a moment talk about something that I've been following for almost a month now, pretty much since it started, um, and that's the coronavirus, or its scientific name is COVID-19. So, my sources, let me just say this up front, my sources are from the World Health Organization, which is the WHO, the CDC, and a couple doctors that I follow on the global network. So none of the information that I'm getting is from any of the American media or any of the BS media that you're seeing out there. I'm getting my information from reputable um, sources. So just the whole point of this video is for me to put some facts out there because I'm seeing people post things on their timelines that showed up on my timeline, and because I've really been studying this, you can ask my wife. I've been looking at this thing every single day for over a month now, and it is in America now. And I think for me this morning it became more of a concern because the third case in Georgia was identified in the media on yesterday, and I think this person went into the hospital on. This person was admitted, and it was identified that she had the coronavirus on the third. Granted, she went into the hospital twice in Floyd County, according to the article, according to everything that I could find. She went into the hospital twice, complaining of flu symptoms. They saw this person twice, and they released her twice. So not only was she in contact with all the people in the hospital, it's unknown how many people she was in contact with when she left the hospital both times when they thought it was the flu. Now, one of the things that I've been noticing out there, and there's a lot of misinformation, but in the information that I found, in America there seems to be a shortage of test kits. So the first thing that I'm going to say, and if you go on the CDC website, and you go to the coronavirus on the CDC website, it tells you that the numbers that you see in the media and that the numbers that you see on the CDC website are not, they're no longer accurate, because now each state is required to report and record their own numbers. Again, if you go onto the CDC website, the numbers that you're seeing is not a representation of the numbers that's actually out there. You have to get the numbers for your specific state and your specific county or whatever to get the accurate numbers. So in the case of Georgia, the state that I live in, the numbers that I'm seeing is between 3 and 5 reported cases, meaning that these people have been diagnosed with COVID-19. All right, so let me get into the difference between a person being diagnosed and a person being quarantined and a person being isolated. Now, a person being diagnosed means that they've been given a test for COVID-19 and they have come back positive for having COVID-19. And I'll talk a little about what COVID-19 is in a second, but there's 3 ways to look at it. COVID-19 patients fall into 3 categories. They fall into hospitalized, they fall into isolation, and they fall into quarantine. All right, so hospitalized mean they're in somebody's hospital being treated. Now, based on everything that the WHO has said and everything that the CDC here in America has said, no one is immune. No one is immune to this disease. This COVID-19 is a form of SARS, which, based on all the science, says that this likely originated because the other 2 versions of SARS, MERS and SARS, or what we know as the I'm gonna just leave it as SARS because I can't think of the name, but the other 2 versions of SARS both originated from bats. And the science at this point is saying that this version of the SARS, COVID-19, which is the version of the SARS, also probably originated from bats from a wet market, open animal market in Wuhan, China. This is they're not calling it a pandemic yet, but they are calling it an epidemic, which is, from my estimation, at the number that we're looking at, I just saw a report saying that we are currently at, globally, right at $100,000. The numbers that the WHO put out yesterday, and I'll go over some of these numbers in a minute. Globally, we were at 95,748 cases. All right, globally. I think in the United States, it was around 13,000 cases. So, in terms of the facts, this is a disease that is being transmitted from person to person. All right, and based on what I saw this morning from the report and the press conference that the World Health Organization did yesterday, there's one reported case in China of it being transmitted to a dog. All right, that's not a big deal at this point, I don't think, unless that number is being suppressed. Like, I feel like a lot of the numbers are being suppressed, but this ain't about opinion. This is about me presenting the facts. All right, so fact number one, again, this COVID-19 is said to originate in bats, just like the other two versions of the SARS, which is MERS, which is the Middle East, which they said the bat bit the camel, and the camel transmitted the disease to the human. The same thing with what everybody knows as SARS. It was also said to be transmitted through or from a bat. And this is likely the case with this one. Again, likely the case. There's a lot of unknowns at this point when they're talking about this disease. There's a lot of questions not being answered and haven't been answered, and probably won't be answered for a long time, at least a year at the minimum. All right, so that's the first thing. In terms of the numbers, let me do this. In terms of the symptoms, I know a lot of the stuff that's going around is that these are flu-like symptoms, and that's not really true. The symptoms are more pneumonia-like than flu-like. The two primary symptoms that people have with the COVID-19 is a dry cough and a fever. Those are the first two things that show up. And a high fever. They're talking about 103 to 104 temperature. So it's a high fever. The fever normally comes first, and then the dry cough. All right, so it's more pneumonia-like than flu. They're saying it's rare that the person will have a runny nose, sneezing, or sore throat. If they have a sore throat, it's probably from the coughing. All right, so those are the symptoms. Again, as I've already stated, there's no known cure, and they're saying that the vaccine, there's currently 20 vaccines in development, but they're saying that the first vaccine probably won't be out until 2021, next year. All right, so, and in that regard, they're not even sure if this COVID-19 is seasonal. So they don't know if it's going to subside through the hot months. That's yet to be seen. So what they're looking at, being that the flu season in America and in the northern hemisphere of the planet is coming to a close over the next 2 or 3 weeks, they're looking forward to see if it explodes in the southern hemisphere, places like South America and places like Africa, which, being that Africa and South America are some of the worst places in terms of health care, it is likely that if this is not seasonal, it's gonna get way out of proportion, and it's probably gonna become a pandemic at that point. So let's get back into the facts. At this point, based on the numbers that's mostly coming out of China, because that's where this started and that's where the majority of the cases are at, this affects older people and people with pre-existing conditions the most. They're the most acceptable, especially older people. If you go on the CDC website, you'll find that the majority of the patients in America are in Washington State, and most of those patients who are either infected or have passed or died, they were in a basically an old folks home, in a care facility. All right. And it's the same thing based on the numbers that's coming out of China. Most of the patients that have died are older. Now, let's get into some of the numbers. Again, the numbers that came out yesterday, and actually I probably should have waited to do this video because they update the numbers every day at noon. But the numbers that came out yesterday from the World Health Organization, there was currently at the time 95,748 cases. Of that number, 53,423 have recovered. And 42,325 is an unknown recovery. And that's the number that's the scariest to me, because it makes me wonder what has happened in regard to those people. Have they lost track of them? Are these people still sick? And, where are they at in the recovery process? And the other part about the recovery process is no one has really said what the estimated time of recovery is. If it's 3 days, is it a week? Is it 2 weeks? It's really unknown. Now, in terms of going back to what I said earlier in terms of the quarantine, for people that's in quarantine, and I'll talk about this more in depth in a minute, they're saying that you have to self-quarantine for 2 weeks. So I'm guessing that they're thinking that the incubation period for this COVID-19 is about 2 weeks, all right, before you actually contract it and before you actually see the symptoms and actually are affected by it. All right, so we'll get back to the quarantine, the isolation, and all that stuff in a minute. But the numbers that is most alarming, and this is every doctor that I've seen that has really no spin bullshit, just giving the facts and giving the numbers based on their professional opinion. The number 3.4% is the mortality rate. All right, meaning that 3.4% of people that get COVID-19 dies. All right, and that number is based on the numbers that the WHO put out yesterday. 3,286 deaths. So again, that's 3,286 deaths as of yesterday. So when you look at the math on that, on the 95,748, that's about 3.4%, give or take, plus or minus the margin of error. All right, so the amount of so just to give you percentages, 55% of the cases have recovered, and about between 42 and 44% is an unknown recovery. All right, we don't know where they're at. So those are a few of the numbers. Now, the one number that stands out the most to me is this number: 11% of the people that have been hospitalized for this die. So even though we have the death numbers, a huge percentage, if you're hospitalized for COVID-19, there's a high probability, 10%, 11%, that's a high mortality rate. All right, that is actually around the mortality rate of the original SARS virus. All right, SARS, the original version, had about a 10% mortality rate. All right, based on my research, and you can go out there and Google and verify, check my facts. All right. So I've already said no one is immune, and there's currently no treatment. So there's two strands of COVID-19. There's the S strand and the L strand. The S strand is the original strand, but they're saying that the S strand is not as virulent and is not as transmissible as the L strand. The L strand is the one that early on in Wuhan that caused the explosion. And then they got it under control. They contained it. So they feel like in some of the things that I've been seeing and reading, they feel like in that the L strand has been contained, but even this is unknown because the media hasn't really said which strand of the COVID-19 virus has spread worldwide. All right, so for all we know, all the cases in America could be the L strand, which is the more virulent, the more transmissible version of this virus. So basically what they're saying happened is at some point within the China explosion that this virus mutated from the S to the L. And, and it's also been a confirmed one case in America. It was a man. He was recorded to have both the L and the S strand. So if nothing else, we know in the United States that there's at least one person with the L strand of the virus, but he also has the S strand as well. They haven't said if the virus is any more dire or more catastrophic if you have either one of the strands. All they're saying at this point is there are two strands. Again, there's a whole lot of unknowns about this virus. All right. It is not the flu. All right. Now, some of the symptoms that come with it, outside of the ones that I already named, are flu-like, but the initial symptoms are more pneumonia-like, where you have a fever and you have a dry cough. All right. So, what else? So, let's go back to what I was talking about when I first started the video. If you got COVID-19, you fall into three categories. You fall into the hospitalized, which is self-explanatory. Then you fall into the quarantine, or isolation, I should say first, and then the quarantine. Now, the difference between isolation and quarantine. Isolation means you have been confirmed and have tested positive for the COVID-19 disease. All right, or virus, however you want to say it. You have been confirmed that it has been confirmed that you are positive. All right. Now, a person in quarantine, all that means is that they have probably and likely come in contact with a person that has been confirmed to have COVID-19. All right. And they're saying, they're asking that people that are asked to be put in quarantine or self-quarantine, that they take 2 weeks basically away from the rest of the world. All right. And in this case, they're asking, but some states like the state of New York and the city of New York, it's mandatory, meaning they have you on police watch. So some places, they might not be doing that. New York is the only one where I've seen where it's on the record that they are mandatory. The quarantines and the isolations are mandatory, and they have police monitoring, or the public officials monitoring these people to make sure that they don't go outside and that they're not interacting, so on and so forth. So that's that part of it. How do you help prevent the spread and keep yourself safe? Again, this is one of those things where they're not really sure about. The only thing that you'll go on the CDC website, the World Health Organization website, most of the medical websites will tell you to wash your hands. They're saying 20 seconds. I'm saying 30 seconds. That extra 10 seconds I feel like is just, enough, to give you to make sure that you're washing your hands well. The other thing is to cover your mouth when you cough or sneeze. Inside of that coughing and sneezing, if you're around people, if you're in group environments, concerts, inside of a restaurant, you want to be conscious of how close you are to people. 6 feet is what they're saying. Give yourself a 6-foot buffer between you and somebody else. That's what they're saying. I know in some cases that could be hard, but that's what the medical professionals are saying in terms of how to handle when you're in environments where there's a lot of people congregated. And there's 3 ways that this is transmitted. All right. There's the immediate, which means that you got it directly from the source. There's the cluster, meaning that you're inside of a group. So like the example of the cruise ship Prince, that was a cluster. And then you have the communal spread, where, you just out and out in your regular daily life, and you just happen to be in somebody's presence with it for a few minutes, and it's communally spread. And that's the way that they're saying that the majority of the people that have tested positive throughout the world has contracted this disease. All right. So, which answers the question, is it airborne? All right. Yes, it is airborne if you're close enough to get somebody's moisture, and it's not just spit or blood or something like that. Even when I speak, there's moisture coming out of my mouth. Even when I breathe, there's an amount of moisture coming out of my nose. So that's something to think about, and that's where that 6-foot rule comes into play. All right, and so that's something to think about. And I don't want to get too much onto that because I don't want to create an air of panic. This is the whole point of this video is to inform people. But that's where that 6-foot rule comes into play in terms of how it's spread. All right, so. Again, we talked about the quarantine. I talked about isolation. We talked about, the two types of COVID that we know about. The two types of COVID-19 that's out. I talked about the numbers. I talked about how to help prevent. The other thing about prevention is that you want to pay attention to people that's showing signs. And I know it's flu season. So it may be one of those things where you're looking at a person and you're saying, is that the flu or is that COVID-19? So again, the thing to remember is that based on all the research, they're saying that a person with COVID-19 rarely has runny nose, sneezing, or sore throat. All right. The sore throat is kind of a consequence of a dry cough with COVID-19. It's not a symptom. All right. But runny nose and sneezing, I think, are the big two when you look at COVID-19 versus the flu. Those are the two things where we as people that this is impacting, we need to be aware of. So if the person that you're looking at, if they don't have a runny nose or they haven't been sneezing, then I'm going to err on the side of caution. And I'm going to advise that you do too. And this is what the healthcare professionals are saying. All right, so, and then the last thing, and I think I've already said this, do not listen to the national media. Do not listen to Donald Trump. All right, do not. Because a lot of the national media is spinning this shit, and it's not accurate. It is not accurate. You go on the CDC website, and it says that all the numbers are currently being kept by the states and local government. So if you're getting your news from Fox, from CNN, from MSNBC, if you're getting it from all these normal news sources, I advise you to change where you're getting your news from. Start looking and pay attention to your local news, because your local news is going to be what affects and impacts you. All right? Because this is real. I've seen people post, things on their timelines. I understand you want to pray about it. I get it. It is what it is. I can't tell people not to do that. But this is a real existential threat that is immediate. In my case, the third case that came out yesterday in Floyd County, that hospital that person was served in is less than an hour away from my daughter in college. So this is real personal to me. I know that Floyd County is about an hour and a half, almost 2 hours outside of Atlanta. So it is that close to a major metropolitan city. So this is real for me. So, and I think it should be real to everybody involved. And by no stretch of the imagination am I saying panic, am I saying start hoarding stuff. I'm not trying to make this into the sky is falling, the world is ending scenario. This is not that. This is not some conspiracy bullshit. Everything that I just said on this video came from reputable sources. People that do and deal with this type of thing, this is what they do every single day of their life. So I just wanted to put this video out there because, again, I saw people posting stuff, and I wanted to be a person, I guess, a beacon of reality and realness in this situation, because it is a situation where this will, at some point, probably impact everyone in some way. All right, so that's it for now. Peace.